John Hayden Hancock, and I'm in nursing 1119.
Also suction if I needed to with the suction machine. And then before I go, I'll use the corner hygiene for my patient so she can get that napkin off of her mouth. And then I'm going to make sure, I'm going to check and make sure that
Come in.
you did not.
Good morning, Miss Pearl. My name is John Hayden. I'm going to be your student nurse today. Can you verify your name and date of birth for me, please? Okay. Now, Miss Pearl, I've reviewed your vitals, and I've also checked your patient record for any kind of allergies, and everything does seem normal. I've been instructed by your physician that I will be inserting an NG tube today.
And whenever I come back to take the tube off,
Is there anything that you need before we get started? Okay, Miss Pearl. First, I'm going to start by raising you up
I'm going to get this.
to a waist level height. And I'm also going to be raising you to high phallus position. Also, for this procedure, we do have suction available for your tubing being inserted. All right, Miss Pearl. Okay, first thing we're going to do is inspect your nasal cavity. Okay, both those seem good. And I'm going to also check your gag reflexes. Good to me. Okay, Miss Pearl. Next, I'm going to be measuring your tubing. Okay, and I'm going to mark that with some tape. Perfect. Next, I'm just going to be laying this towel down for protection. If this gets messy, I'm going to be providing you with this water basin and some water to sip on during the procedure. Put that there for you. Going to don new gloves, and also provided hand hygiene when I walked in. I forgot to tell you that, but I did. Okay, next we're going to be lubricating the tip of this tube that will be inserted in your nose. And then I'm going to get you to sip on this water as I'm going to be inserting this. And if you can, just tuck your chin, and whenever you swallow, I will be advancing it. And if this procedure may become any kind of uncomfortable or anything like that, just raise one finger and I'll know that you're in pain, that I need to adjust. Okay, Miss Pearl. Doing good. There we go. Sorry, this is uncomfortable.
Do you want me to go ahead and I'll do that? Are you doing the one here?
Okay, there we go. Okay, now that we've done that and that's inserted in you, I'll now assess the the gastric content within your stomach. 60 milliliters. Okay. Also going to attach this to suction. I'm going to assess it in here. And I'm also going to be testing that for normal pH. And normal pH in the stomach would be 1 to 5, and it is. Perfect. Next, I'm going to be taping your nose. And I'm going to be assessing for coils in your throat. Make sure it didn't get tangled or anything. And we're good. And then assessing that tape. Make sure it's on there good. Take away water if you're good. Okay, Miss Pearl. I'm going to connect you to suctioning. Then I'm going to remove towel. And then if my patient were to have any kind of feeding or medication, then we would need an x-ray to verify placement with that. And then that, I'm gonna don gloves. And then I'm also gonna attach this to her sleeve and providing oral hygiene for her. After oral hygiene, I will then provide hand hygiene, new gloves, lower her to 30. Oops. And then if Miss Pearl were to need more hygiene, oral hygiene, I would be able to do that. I'm also going to lower that waist, the height of the bed a little bit too. Okay, Miss Pearl. Is there anything else that you need? Have your call light in reach. And then I will be back later to remove your tubing. Okay. Come in. Hi, Miss Pearl. I'm back to remove your tubing today. First, I'm gonna raise the bed up and to high Fowler's position again. I'm gonna go ahead and check, verify your wristband once more, and raise you up. Before we get started, I'm going to turn off that suction, and then I'm going to remove that tape from your nose. Slide this down. Perform hand hygiene and gloves. And then I'm going to get you to take a deep breath. And as you take a deep breath, I'm going to be pulling out. Okay, Miss Pearl. I'm going to assess this. Bundle it up. Wipe your face for any story. Expose that. I'm also going to be assessing the suctioning canister and emptying that. Okay, Miss Pearl. Next, I'm going to be providing new gloves, hand hygiene, and then oral care. Going to be lowering you down to a more comfortable position. Oops. Okay. If the patient were to, while I was inserting the tube, if she were to be having any excessive coughing or gagging or become cyanosis, then I would stop the procedure. But Miss Pearl was good to go, so she didn't need that. Okay, is there anything else that I can do for you today, Miss Pearl? Call light in reach. I will document this procedure, and you will let me know if you need me. Okay.